Welcome back to the deep dive. Today, we're tackling a really important topic, Lyme disease.
Definitely important. And we're using this great set of revision notes specifically put together for learning and recall. They're really comprehensive.
Exactly. So our mission today is to pull out all the high-yield stuff from these notes, cover the essentials, what it is, causes, risks.
How it affects the body, what else it could be confused with, who gets it, how it shows up.
Investigations, management, prognosis, the whole lot.
And the structure mirrors the notes, which should make it perfect for revision.
Okay, let's dive in, starting with the basics, the definition.
Right, so Lyme disease, at its heart, is an infectious illness.
Caused by?
A bacterium.
Yeah.
It's called Borrelia burgdorferi.
Got it. Bacterial infection. And how do people actually get it?
The main way, the one to really focus on is through the bite of an infected tick.
Okay.
Specifically ticks from the Ixodes species that carry the Borrelia.
So tick-borne. And which parts of the body are typically hit?
Well, the notes highlight it can affect multiple systems. We're talking skin, joints, the heart, and the nervous system too.
And it's not just the bacteria causing trouble.
No, exactly. Your body's immune response to the infection is actually a big part of the picture, contributing to the symptoms.
Interesting. The notes also mention regional differences.
Yeah, this is quite key. Different Borrelia species seem dominant in different places and cause slightly different problems. Well, in the U.S., Borrelia burgdorferi is often linked strongly with arthritis. But over in Eurasia, you might see B. guerini more, which is associated more with neurological issues.
So where you get bitten matters.
It can definitely influence the presentation, yeah.
And how common is Lyme disease overall?
The sources suggest the incidence is, well, it seems to be rising. Could be climate change. Could be better detection, probably a mix.
But still relatively rare.
Still considered relatively rare, yes, but awareness is certainly much higher now.
Okay, let's dig a bit deeper into the cause. Etiology. We know the bacteria is Borrelia burgdorferi.
Correct. And it's a specific type, a spirochete, kind of spiral-shaped. Right. And like we said, transmission is overwhelmingly via the bite of infected black-legged ticks. So that's Ixodes scapularis or Ixodes ricinus, depending on where you are.
Are there any other ways it can be transmitted? Less common ones.
The notes mention rarely other tick species might play a role. And there's some mention of very rare vertical transmission, mother to fetus. But honestly, for practical purposes, it's the Ixodes tick bite you need to know about.
Makes sense. Okay, risk factors. Who really needs to be aware of this?
Well, the biggest risk is simply spending time in places where these ticks live.
Which are?
The notes specify wooded areas, grassy areas. Think forests, fields, even some gardens.
Anywhere with vegetation, basically.
Pretty much. So obviously doing outdoor activities there, hiking, camping, even gardening, ups your exposure.
And not taking precautions.
Yes, that's crucial. Not using adequate tick protection measures like repellents or clothing checks definitely increases the risk.
Right. So let's follow the process. You're in a tick area, you get bitten, the bacteria gets in. How does it actually, mess with your body? The pathophysiology.
Okay. So the Borrelia enters at the bite site, but it doesn't just stay there. It can get into the bloodstream.
And spread.
Exactly. It spreads systemically. And that's how it reaches those different organs and tissues, the skin, joints, heart, nerves, causing the symptoms we see.
It seems quite good at getting around then.
It is. And the notes mention it has ways to sort of evade the immune system to some degree.
Which might explain why it can sometimes persist.
That's thought to be part of it, yeah.
Yeah.
It can potentially lead to longer-term or chronic infection in some individuals. The tick itself, remember, is just the vector, the delivery system.
How do the ticks get infected?
The notes touch on the tick life cycle. It's complex. Larva, nymph, adult stages.
And they feed at each stage.
Yes, on different hosts. Often small mammals first, like mice, which are reservoirs for the bacteria, then maybe larger animals or humans. The nymph stage is particularly important for transmission to humans.
Why the nymph?
Because they're tiny, really hard to spot, and they're most active in the spring and summer when people are outdoors more.
Okay, so it's a whole chain. Mouse, tick, potentially human. And once it's in us...
Well, your immune system might fight it off completely. That can happen. Or the bacteria establishes itself and starts causing those clinical signs, which, again, can vary depending on the strain and where you are.
Right, which leads perfectly into the next big challenge, differential diagnosis, because Lyme can look like so many other things.
Absolutely. It's famously called the Great Mimic. You really have to think broadly. The notes are good here, listing conditions they can present similarly.
Especially with the rash, right? erythema migrans.
Yes. If the rash isn't a perfect bullseye, or maybe it's small initially, it could be confused with just a reaction to the bite itself.
Oh, yeah.
Or things like ringworm, cellulitis, hives, urticaria. Even other rashes like erythema nodosum or contact dermatitis are mentioned.
Yeah.
The key thing is, not every red patch after being outdoors is Lyme disease.
Good point. What about things that feel like an infection generally? Fever, aches.
Loads of overlap there. The notes list some viruses like parvovirus B19, West Nile,
Yeah.
and other bacteria relapsing fever, syphilis, lepto, even mycoplasma or infective endocarditis.
Wow, that's broad.
It really is. That's the challenge.
And non-infectious conditions, too.
Definitely. Other tick-borne diseases like anaplasmosis or basiosis can coexist or mimic Lyme. And then conditions with chronic symptoms like rheumatoid arthritis, fibromyalgia, chronic fatigue syndrome, because Lyme can cause that persistent joint pain and fatigue.
Understanding that differential list is crucial then.
Absolutely vital for diagnosis.
Okay, let's switch gears slightly. Where and when are we actually seeing Lyme epidemiology?
So geographically, it's found in rural and woodland areas across the UK, Europe, North America.
Any UK hotspots mentioned?
Yeah, the notes list places like Exmoor, the New Forest, South Downs. But honestly, could potentially be anywhere with the right habitat and affected ticks, not just those famous spots.
And it seems like we hear more about it now.
We do. The notes suggest reasons like climate change, possibly expanding tick ranges,
Right.
maybe more people doing outdoor stuff, and definitely better awareness and detection.
Are there stats?
Yeah, a few key ones. Interestingly, about 15% of UK cases are actually picked up abroad. USA, France, Germany, Scandinavia are mentioned.
Okay.
Since '97, over 6,900 cases reported in England and Wales. The average rate is around 1.73 cases per 100,000 people.
And a peak season.
Summer. Makes sense. More ticks, more people outdoors.
Any age groups particularly affected?
It hits all ages, but the notes show peaks in the 45-64 group and also 24-44. So middle-aged adults primarily, but kids and older adults get it too. Remember, summer peak, middle-age groups.
Got it. Okay, so we know the what and who. Let's talk about how it actually looks clinically. The presentation, which can be really variable, as we've said.
Hugely variable. And you might not get that classic rash. The notes structure it by stage, which helps. Early features first, usually within 30 days of the bite.
And the absolute key thing here is
Erythema migrans, the rash. That's the highest yield sign for this stage.
the bullseye.
Usually, yeah. Though it might just be an expanding red circle. It happens in maybe 70% of patients.
So 30% don't get it.
Exactly.
Yeah.
Important to remember. If it does appear, it's typically 1 to 4 weeks after the bite, usually painless, gets bigger than 5 centimeters, and expands slowly.
Any other early signs?
Yeah, you can get systemic symptoms alongside it, or even without it. Things like headache, feeling really tired, lethargy fever, maybe some joint aches, arthralgia, flu-like, basically.
And if it's missed or not treated then, what happens later?
Then you can move into later features or disseminated Lyme disease. Stage 2. This is usually after 30 days, when the infection has spread more widely.
What does that look like?
You might still have those flu-like feelings, but often more intense joint and muscle pains, headache, fever, fatigue, nausea, vomiting sometimes. And this is where more serious things can crop up.
Such as?
Neurological problems are key here. Facial nerve palsy, like Bell's palsy, is classic. Also nerve root pain, radiculitis, or even meningitis.
And the heart.
Yes, cardiovascular issues can happen. Heart block, which affects the heart rhythm, or myocarditis, inflammation of the heart muscle. Also, rarely, a skin thing called a lymphocytoma, a bluish-red lump.
Okay. And then even later, stage 3.
Right, late manifestations. These can pop up months, sometimes years, down the line. The most common late feature noted is arthritis.
Affecting which joints?
Often large joints, particularly the knee, it can come and go.
Right.
There's also a rare skin condition, acrodermatitis chronica petroficans, ACA.
And late neurological stuff.
Yeah, things like polyneuropathy, so nerve damage, chronic inflammation in the brain, and spinal cord encephalomyelitis, vertigo, and very rarely psychosis.
Now, the notes mention chronic Lyme and post-Lyme syndrome. What do they say about that?
They highlight these terms are, well, controversial. They're often used for persistent symptoms, fatigue, pain, brain fog that stick around even after antibiotic treatment.
What's the controversy?
It's mainly about defining these symptoms, figuring out the exact cause, and the best way to treat them. There isn't full agreement in the medical community, but the notes acknowledge it as a potential outcome for some people.
Okay, so given all these possibilities and mimics, how do doctors actually pin this down? Investigations.
Right, another really high yield section, especially the testing approach. And the notes make a critical point first. If someone has that classic erythema migrans rash and the story fits like they were hiking in a known tick area.
Diagnosis is clinical.
Exactly. You treat based on the rash. You don't wait for blood tests. That's key.
Okay, so when do you test?
You test if you suspect Lyme, but they don't have that definite EM rash. Maybe they just have the fever, aches, neurological signs.
And the test is?
It's usually a two-step process. First line is an ELISA test, enzyme-linked immunosorbent assay, looking for antibodies against Borrelia.
What if that's negative early on?
Good question. It can be negative early because it takes time for antibodies to develop. The guidance mentioned in the notes suggests if it's negative within the first, say, 4 weeks of symptoms, you should repeat it 4 to 6 weeks later.
Give the body time to react.
Precisely.
And if the ELISA comes back positive, or maybe borderline equivocal,
Then you confirm it. You move to the second tier, which is an immunoblot test, sometimes called a Western blot. It's more specific, helps rule out false positives from the ELISA.
Okay, so ELISA first. If positive or unclear, confirm with immunoblot.
That's the standard pathway. The notes also mention other tests for specific situations, like PCR on joint fluid if you suspect Lyme arthritis.
But testing isn't always needed or even helpful.
Right. The notes strongly advise against testing people who have a low risk and only vague, nonspecific symptoms, like just feeling tired. It can lead to false positives and confusion.
Makes sense. Use the tests wisely. So once you have a diagnosis or strong suspicion, management.
It comes down to antibiotics. That's the core treatment stated in the notes.
Which ones?
Depends on the stage and severity. Common ones listed are doxycycline, amoxicillin, or cefuroxime. The duration also varies.
What about if someone just finds a tick on them? Do they need antibiotics just in case?
No. The notes are very clear. Routine antibiotic prophylaxis after a tick bite is not recommended based on the UK source guidance.
So what should they do?
Immediate action is just remove the tick properly. Fine-tip tweezers, pull steadily upwards, then just watch for symptoms like the rash or fever.
And if they do get the EM rash?
Clinical diagnosis. Start antibiotics. No testing needed first.
What about more complicated cases, neurological Lyme, heart involvement?
Those generally need referral. The notes say refer for specialist assessment. They might need intravenous antibiotics or specific management, say, by a dermatologist for ACA or lymphocytoma.
Okay, key management points. Antibiotics are central. Choose based on the stage. Remove ticks, but no routine prevention pills. Treat EM clinically. Refer the complex stuff. Got it.
That's a good summary.
What's the usual outlook? Prognosis.
Generally pretty good if it's diagnosed and treated early. Most people recover fully with the right antibiotics.
But not always straightforward.
Not always. The notes mention post-treatment Lyme disease syndrome, PTLDS, can happen, where symptoms like fatigue, pain linger after treatment.
Which ties back to that chronic Lyme controversy.
Exactly. But the notes do emphasize that many people make a full recovery.
Is it often fatal?
Very rarely fatal, according to the notes. Early treatment is highly effective at preventing the really serious complications.
Right. Which brings us to complications. If it's not treated effectively, what are the risks?
Well, untreated or late diagnosed Lyme can lead to those longer-term problems we touched on. Neurological issues, nerve damage, memory problems, cardiac issues, rhythm problems, and joint damage, like chronic arthritis. Multiple systems can be affected long-term.
So prevention seems like the best strategy. What are the key prevention tips from the notes?
It's all about tick avoidance in those high-risk areas. Wear protective clothing, long sleeves, trousers tucked into socks, creates a barrier. Definitely. Use an insect repellent that works against ticks. And check yourself, inspect your skin thoroughly after being outdoors. Check kids, check pets too.
Why is checking so important?
Because ticks often need to be attached for quite a while, maybe 24 to 48 hours or more, to actually transmit the bacteria. So finding and removing them quickly can prevent infection.
Is there a vaccine?
Not currently available for humans, no. The notes mention some countries might recommend a single dose of doxycycline after a high-risk bite post-exposure prophylaxis. But again, stress that this isn't routine policy in the UK source material.
Okay, let's try and wrap this deep dive up then. We've gone through Lyme disease pretty thoroughly based on these revision notes, from the cause, the Borrelia bacteria, and the Ixodes tick.
To how it spreads, the pathophysiology, the wide range of symptoms across different stages, and crucially, all those conditions it can mimic.
We covered the epidemiology, where and when it occurs, the investigation's pathway, starting with clinical diagnosis for EM and the two-tiered testing otherwise.
the antibiotic management, the generally good prognosis with early treatment, potential complications, and finally, those really important prevention strategies.
Understanding these core concepts, especially structured like this for revision, is just so vital.
Absolutely. Whether you're studying for an exam or just want to be informed when you're out and about.
You know, what really stands out is that contrast. The clear-cut, treat the rash on site versus the complex investigation needed for other presentations. It really shows the art and science of diagnosis, doesn't it?
It does. And the ongoing evolution in understanding, like the discussions around PTLDS, raises a key point for the future, I think. How do we maintain clear, evidence-based communication about Lyme for doctors and the public, ensuring people get diagnosed quickly and managed effectively without causing unnecessary anxiety or confusion? It's a balance.
That's a really important thought to leave people with. Balancing awareness with accuracy. So if you need to go over these high yield points again, this deep dive, drawing on those revision notes, should be a great resource.
And definitely check out the places where materials like this come from. PassTheMSRA.com and FreeMSRA.com have fantastic resources.
Invaluable for revision. Definitely check them out.
Absolutely.
Until next time, keep diving deep.